A 50-year-old cricket enthusiast suffered a stroke after playing 2 matches, an activity he typically does 2 to 3 times a week. His wife disclosed that he had been experiencing back pain due to a slipped disc condition for 8 to 10 years. This information enabled Dr. Natasha Gupta to comprehend the impact of the back condition on the spinal dura. She deduced that the traction forces from the back to the neck must have altered the pressure on the vessels, thereby forming dural adhesions. On observation, Dr. Natasha found patient's right leg was functionally shorter due to fascial chain shortening. His right hip was stuck in an elevated position and in an external rotation position. On listening technique, when she placed her hand on his head, she could feel his right side of the head was pulling her hand laterally, and then it rapidly moved her hand in an external rotation position. Practitioner also found his skull had osseous restrictions, had loss of elasticity in the bones of the skull, mainly the frontal bone. His liver was also found stuck in the posterior rotation, lateral rotation, and counterclockwise rotation position. Imagine main vessels along with liver being pulled in the above described positions. This is enough to increase pressure in the vessels. When the head and neck are out of alignment, blood vessels in the skull are subjected to constant tension, stretching, and pulling. This prolonged mechanical stress can compromise vascular integrity, increasing the risk of infarction and other vascular-related issues. To gain a deeper understanding, let's examine his facial alignment. Imagine a vertical line extending from the midpoint of his chest. Notice how the right side of his face deviates from this line. It shifts outward, laterally, and then rotates externally. Head and neck malalignment, traction forces from the big organ like liver, compression of the skull bones, spinal dural adhesions, lymphatic blockages at different spinal levels, all these factors can reduce blood supply to the brain. Without a steady supply of blood, the brain cells can die from a lack of oxygen. This is enough to cause a stroke.